This is Dr. Daniel Paul with Easy Orthopedics, and today I'm going to answer the question, how do I know if I have a torn rotator cuff? The short answer to that is MRI, but you don't necessarily need to always get an MRI, if you have shoulder pain. So what is the rotator cuff? The shoulder, well, I'll start by saying this. The hip is like a ball and socket joint, just like you would think. The shoulder, they'll sometimes call them ball and socket joint, but it's more like a golf ball sitting on a golf tee. And then above that is the rotator cuff, which basically holds that golf ball on the golf tee. And that is not the main, that basically just helps you move your shoulder around and kind of keep things in alignment. So sometimes people can tear that cuff of muscle and experience pain. And that's maybe why you're watching this video. Now, over time, if you've had a rotator cuff that's been torn for a long time, eventually you get muscle atrophy in those rotator cuff muscles, and then the surgery to fix it doesn't really work that well, and you can end up getting arthritis. But this is assuming that you have a rotator cuff tear. So what the best thing to do to determine if you have one is to see your doctor and they'll do a physical exam on you. And through the physical exam, you can get a pretty good idea of someone's rotator cuff strength. Some common tests I use are the empty can test. If they can hold their arm up like this against strength, usually it's pretty good. I'll test for the other muscles by having them push against my arm outwards and then inwards on their belly for the subscapularis. But that's the best indicator. Now, if I'm examining someone and they've had an accident and they can do that pretty well, I'm usually not super concerned about a rotator cuff tear. In fact, usually it's shoulder impingement that's causing their issue, or or also called shoulder bursitis. So definitely where you start is seeing your doctor. Make sure it's someone who sees shoulders, preferably an orthopedic surgeon or a family medicine doctor, or a physical medicine and rehabilitation doctor. And they can get a pretty good idea. And, sometimes it's obvious, yes, I think you've torn it, let's get an MRI and look at it. Other times, I think it's impingement, let's try steroid injections, some PT. If it's still bothering you then you can get an MRI. But jumping to an MRI right away, it's not always the best idea unless your doctor thinks it's so. If you find out you do have a torn rotator cuff tear, then usually the solution is surgical. It just depends on how deep the tear is. Did you tear it the whole way or just a small way? And it depends if you have pain. Most people with rotator cuff tears do have pain, and they do end up with surgery. But again, the first step to do is see your doctor, talk about it with him. If he thinks it's torn or he or she thinks it's torn, need an MRI, then you get the MRI, and that'll tell you for sure. I hope you found this video helpful. If you have any questions or comments, feel free to leave them below, and I'll do my best to respond. And if you like this channel, I come out with content regularly, and feel free to subscribe.